As you know, Arrowhead Regional Medical Center is owned and operated by the County of San Bernardino, and we are the only public hospital or safety net hospital in the county. And as such, most of our patients are Medi-Cal patients or are uninsured. And so because of that, you can imagine that we have some deep concerns about the proposed cuts to Medi-Cal that Governor Schwarzenegger has proposed. So for this reason, we've invited you all here today. We'd like to give you a little more insight into how those proposed cuts are going to impact our medical center, and most importantly, of course, how they would impact the patients that we serve. So at this particular time, I'd like to introduce you to Dr. Dev Ganadev. He's our medical director, and he's the chief of surgery here at the medical center. And I'd be glad to spell his name for you. First name is Dev, D-E-V. Last name is Ganadev, G-N-A-N-A-D-E-V. Dr. Ganadev?
Thanks, George. I've been a trauma surgeon and a vascular surgeon for about almost 30 years. These May revised Medi-Cal cuts are actually went from bad to worse. We thought what was proposed were bad, but what came out was even worse. Unfortunately, it's from people who wanted to cover every Californian with health care. A few months later, we got the story that basically, by the way, guys, we're going to take $1.3 billion away from health care and safety net. We're standing in front of the emergency room for a specific reason. In the past decade, 70 emergency rooms in California closed, while the population of California doubled. This emergency room went from about 60,000 patients per year to about 120,000 patients per year within the last 5 years. It's functioning beyond capacity. Just imagine what will happen if more people show up. So if you cut the Medi-Cal, what will happen is patients can't find their doctors. I think most of you know that Medi-Cal pays about $24 for a mid-level visit, for an office visit. You take 10% away, how many doctors are going to see their patients? Anytime they see those patients, they lose money. So they will end up and get their primary care in the emergency room. If that happens, you know what's going to happen. Whether you're insured, uninsured, trauma victim, everyone will suffer because there is no place in the emergency room to see any more patients. So my hope is that we'll really reverse these cuts and make sure that we take care of Californians. Otherwise, I'm not sure what the Californians without health care, Californians with Medi-Cal, are the Californians with health care in an emergency where they can go. They can't come to any more emergency rooms. Now I would like to introduce Senator Gloria McLeod, senator from 32nd Senate District. Gloria.
I want to thank Dr. Dev and Dr. Ganadev and the medical director here for the Arrowhead Medical Center, Jorge Valencia, which is the chief financial. You know what? I am very, very proud to be standing here with these men and women on the front lines. They are the ones that protect the health of Californians. Protecting the state's network of safety net hospitals, emergency rooms, and trauma center is vital to California's public safety and quality of life. It really is a matter of lives. And my district comes from Los Angeles County all the way to San Bernardino County, and this is felt across all of the counties in the state of California. And we have with us here today paramedic Jason McLaughlin, and I also want to introduce Dr. Rodney Berger, chairman of the Emergency Medical Department, and Jan Serrano, a registered nurse and trauma service coordinator. We will have Josie Gonzalez, which is our supervisor here from the 5th District in which this hospital lies, and Assemblywoman Wilmer Carter. We also have a patient, Renee Ebler, and we have the AARP and the CNA, which has helped us here. And, you know, as Dr. Dev said, we have gone from bad to worse. And with that, I would like to now introduce paramedic Jason McLaughlin.
Hi, my name is Jason McLaughlin. I'm a firefighter paramedic with San Bernardino County Fire. I work up in the city of Hesperia. One of our biggest recent problems that we've been having is what we call bed delay, which is basically just a backup of ambulances and emergency workers in the emergency room. One of the problems is there's too many patients in the emergency room, which causes a backup in the field. From our aspect, we end up having a lot of ambulances on bed delay in the hospital, and they're unable to run calls in their districts that they cover. So therefore that causes a backup in the field, causing a delay of response and emergency care to the civilians in which that we serve. That's pretty much about it from our aspect. I'd like to send the next person up.
Hi, my name is Jan Starr, and I'm the Trauma Program Coordinator at Arrowhead. One of the biggest concerns we have is the increasing number of patients in our emergency department. There's only a finite number of staff that we can get, as you're well aware of the nursing shortage, but there's an infinite number of patients that are coming through. And the reality is that it's going to affect the quality of care we can provide due to the limited staff. Nursing is very concerned about this because we pride ourselves on the quality of care we can provide, and this is being jeopardized.
My name is Rod Borger. I'm the chairman of emergency medicine here at Arrowhead. And as Dr. Ganadev said earlier, in 2002 we were seeing about 60,000 patient visits per year. Now we're scheduled to see 120,000 patient visits, which, and it's not unusual for us to see 400 patients in one day. Of those, probably about half could be seen in primary care clinics. But the reason they're not is that there is no funding and there aren't any specialists that will take care of these patients. Medi-Cal in last year's budget was already severely underfunded. And shame on us as Californians that we're proposing to cut further a program for the poor and disabled, people that can't speak out for themselves, to help balance the budget. We can't allow this to happen. I'd like to just give two quick scenarios that patients I've seen very recently. One was a patient who had full scope Medi-Cal and had a broken leg and lives in the Barstow area. They had to be sent in an ambulance from Barstow to here because there isn't an orthopedic surgeon between Barstow and San Bernardino that routinely takes Medi-Cal. Every outpatient visit, that patient who already didn't have much income had to come from Barstow in public transportation to Colton. You can see that that's obviously not feasible for our patients, for people that are already poor and disabled. And with gasoline at $4 a gallon, that's something that is not doable. Another patient is somebody I saw with renal failure who needed dialysis. In order to get dialysis, they had to have what's called a AV fistula in her arm to plug in the dialysis machine. She had a problem with that fistula, which is not uncommon with people with dialysis. So her doctor referred her to a vascular surgeon to have this done as an outpatient, which is routinely done for people with insurance. She waited, it needs to be done within 3 or 4 days. She waited fourth day for her appointment. Her doctor said, "I'm sorry, you only have Medi-Cal. I can't see you. You need to go to the emergency department." She ended up waiting another 2 days, came to the emergency department. This time she was already in congestive heart failure and ended up having to be admitted to the hospital for 10 days for treatment that almost killed her. This is something that can be routinely done as an outpatient, but because the rates are so poor, they can't be done as an outpatient. It's not that the doctors don't want to see patients. They already see a number of patients who don't have any insurance. the problem is the rates are so poor that they can't even afford to pay their office staff off of what Medi-Cal is paying, and it's creating a very severe access issue for Medi-Cal patients, especially in our county. In LA County, it's only worse. Please, I just wanted to get the message out that Medi-Cal is already severely underfunded and can't take any further cuts. Otherwise, everybody that uses emergency departments, not only Medi-Cal patients, are going to be affected. Thank you very much.
Hello. The governor has finally recognized what I've been saying for months, that you can't cut your way out of a deficit. Yet, the governor is proposing drastic cuts to health care. We're here today because the biggest of these cuts is to Medi-Cal and to our public hospitals. The governor's budget proposes to take almost $100 million annually from public and private safety net hospitals, including this one here at Arrowhead. The governor's budget would also eliminate Medi-Cal coverage to over 250,000 low-income children and adults in this upcoming fiscal year. It doesn't mean that they won't still get sick and show up here at the ER needing services. It simply means that Arrowhead will no longer get paid for treating them. That's what it means. Under this proposal, the already low reimbursement rate that the state pays would be reduced by 10%. That will essentially take California's Medi-Cal rates, already some of the lowest in the nation, to the bottom of the barrel. The governor needs to understand that families here in the Inland Empire are working hard and getting less. We need a responsible budget that makes it easier to get medical care, not harder. As we move forward with the budget negotiations, it should be a priority to not take away crucial services. All options must be kept on the table, and we must remember that our decision should be based on the impact of lives and our health, not just on the dollar figures. We cannot rely on more short-term fixes like using the lottery to create a rainy day fund. We need to fix the structural problems that create our chronic budget crisis. We need to find new revenue sources, and I will support every responsible effort toward that goal because I understand that lives are depending on it.
I want to thank everyone that joined us. I want to also acknowledge Council Member Oliva and Council Member Mitchell from the City of Colton that have also joined us here. And I want to give a special thanks to the Pro Tem, it's Don Parada. You know, we had in our caucus in the Senate, we had been focusing primarily on education and the cuts that it had. But I have had Dr. Devanoff come to my office. I've had the people come from LA County telling me exactly the same thing, that every time you cut a dollar, you not only jeopardize the people that you serve, but you serve all those other people that will have to be using the emergency services here at this hospital. You would jeopardize the services that they would also receive, even though that they are not Medi-Cal recipients. And so while everybody was talking about education cuts, and I understand how important the cuts to education are, everybody was they knew it was important, but nobody was talking about the cuts to the medical services that we are going to experience. And I took heed to what Dr. Dev said to me. I took heed to what the people in LA County said to me. And so I started talking in the caucus. And I started saying, what about the medical services? What about the medical services? Finally, they listened to me, and they said, this is an important issue. And so I thank the Pro Tem, Don Parada, for making this also as important as the cuts to education. And with that, we'll close with Dr. Dev.
Thank you. Before I just ask if anyone of you have any questions, we have a patient who wanted to say something.
Hi, my name is Renee Eblin, and I have 2 children that currently come here. My son is severely asthmatic and comes to the specialty clinic. If we get cut off Medi-Cal, he won't be able to get his asthma treatments or medication. That is quite expensive. My husband is also a T7 paraplegic who is currently on Medi-Cal. We have a lot of expenses in equipment, medical supplies, and if Medi-Cal decreases this budget, my husband won't be able to get his supplies that he needs.
Thank you. If you have any couple questions, we'll take them. If not, I think we'll end with basically. This is the trouble with the hospital emergency room. No, everybody is always talking. The important thing to remember is these cuts not just don't affect the Medi-Cal patients. That's what I think all of you really should take home. This will affect every one of us, every Californian's access to emergency care. This is what my biggest concern is, not just Medi-Cal or uninsured. We take care of them all the time. They suffer quite a bit, but it will affect everyone. Thank you.
Thank you again, everybody, for attending.